whatever questions you may have. On Friday, September 11th, we identified 105 new cases, and the provincial lab completed more than 12,700 tests. For Saturday, we identified 173 new cases. On that day, our lab set a new record by completing 18,919 tests. Finally, yesterday, we detected 140 new cases and conducted 14,451 tests. I want to take a moment to recognize the significant efforts made by Alberta Precision Laboratories and Alberta Health Services teams over the weekend to bring in extra staff for surge capacity to tackle the backlog of samples. We should not expect daily testing to reach 19,000 tests per day. This has never been our goal, to reach this level on a daily basis. What it does show is the dedication of these teams to help reduce lab testing turnaround times, and this past weekend is one more example of all the work that is going into improving that metric. Although our confirmed case numbers from Saturday and Sunday are somewhat higher than they have been in the past while, put in context of the over 33,000 samples run in these 2 days, these identified case numbers are still manageable by public health. As of yesterday, we had 37 people in hospital with COVID-19, with 7 of those in ICU. Sadly, I must also inform you that one more death due to COVID-19 happened over the weekend. To date, there have been 254 lives lost in Alberta to COVID during the pandemic. Each one is a loss for their friends and family, and I know that many throughout our province continue to grieve. Many others have lost loved ones to other causes as well, and every death, no matter the cause, leaves a gap that we must grieve in different ways than we are used to, given pandemic precautions. My sympathies go out to all those who have experienced loss and grief in this time. Another toll on Albertans has been increased anxiety, as we are all faced with living in a time of uncertainty. We have heard that this is impacting students and teachers with intense scrutiny on school reopening. I want to be very clear that we continue to act quickly to limit the spread of COVID-19 in schools, and that our commitment to transparency in reporting should not be seen as a heightened risk of COVID-19 in school environments. With community transmission levels higher in the past few weeks, it is not surprising to see some cases in staff and students of schools. We continue to identify cases in all sectors of our society. What matters are the interventions in place to prevent spread in the school environment. We will be closely monitoring these interventions to be able to make any necessary adjustments if needed. As of this morning, Alberta Health Services has confirmed 42 cases that were present at 35 schools while infectious. Since Friday's update, we have confirmed 3 more school outbreaks, none of which have been shown to be associated with in-school transmission. The new outbreaks were identified at Lester B. Pearson High School and Auburn Bay School in Calgary Zone, and Ross Shepherd High School in Edmonton. All parents and guardians at these schools were directly notified by AHS and the school over the weekend, ensuring that they had the information they needed before school started today. We have now updated the school map to keep Albertans informed as well. As I mentioned last week, while we are calling these outbreaks, it is important to keep these in perspective. We recognize that it's important to act quickly when cases of COVID-19 are identified, which is why we are treating only 2 cases who were in a school while infectious within a 14-day span as outbreaks. This is a very cautious use of this term. As soon as even a small number of cases are identified, all necessary precautions are put in place within a school. We believe this is important to containing the virus before it has a chance to spread. However, 2 cases is also an extremely low threshold to meet, especially in larger schools. I want parents to understand that notification of a small outbreak is a sign that health officials are acting quickly and doing everything possible to support students' health and learning. Also, while it's important for Albertans to stay informed, We should remember that a small outbreak of 2 cases at a school does not indicate that other classes are at risk or that the broader community faces increased risks of being exposed to COVID-19. All outbreaks are still under investigation by AHS. As I mentioned, so far, there's no evidence in any of these outbreaks that transmission has happened within the school. This means that the virus was brought into the school rather than being spread inside. We are also taking a very cautious approach to identifying close contacts right now. So if a student comes to school while infectious with COVID, our current approach is typically to require that all students' classmates stay home for 14 days. I recognize that this is very inconvenient for families, and I regret the impact this is having on those students and their families. I want to thank those families who are working through this inconvenience over the next few weeks, as the reason for this approach is to gather information about who is most at risk of getting COVID from a school exposure. This will enable us to target exclusions in the future to only those who are most at risk. For now, our exclusions are broad to minimize risk of transmission and to evaluate our close contact definition. Even with a cautious approach, it is likely that as the school year continues, we will eventually see some examples of transmission in schools. Our goal is to keep transmission as low as possible, but we cannot prevent it entirely without imposing restrictions that themselves have harmful impacts. Living with COVID-19 means seeking balance between limiting the harms of COVID and limiting the harms of COVID restrictions. This is yet another example of how we need to keep working together to keep each other safe, both from COVID-19 and from a need for more aggressive restrictions. I have been asked many times about when Alberta will see a second wave this fall and how it will impact our schools, workplaces, and continuing care facilities. The answer is that we may well see rises in cases this fall. What this looks like is up to us. Whether we see a sharp spike in cases, or whether we continue to see ripples where cases rise, level off, and then fall, this depends on how dedicated we all are to following the measures in place and how we collectively respond when cases are rising. Our success in reducing the spread of the virus through community transmission will be determined by the actions of all of us. I know this is a message we have heard many times before. For half a year, Albertans have been following public health guidelines, washing their hands, keeping a 2-meter distance from others, staying home if they're feeling unwell, and getting tested for the virus if they have any symptoms or have come into close contact with someone who is infectious. For 6 months, we have made many sacrifices. We canceled or reconfigured our family gatherings, weddings were postponed or altered, and we have changed how we visit with loved ones in continuing care facilities. Our efforts helped prevent the spread, avoided overwhelming our hospitals, and protected those around us. As we head into this fall and winter, our dedication cannot waver. We are now into the fall with Thanksgiving only a few weeks ahead, and before we know it, winter. Cold weather will bring many of us into closer contact. The best thing we can do to limit any second wave, to ensure a safe Halloween, and to support a healthy school year is to keep community transmission low. Each of us continues to be a shield, protecting our friends, family, and neighbors. We can all help prevent school and workplace outbreaks by being extra diligent in the weeks ahead. If we all keep washing our hands, staying home when sick, and taking all the other small but crucial measures to prevent COVID-19 from spreading, we can and will come through it together. Thank you, and I'm happy to take any questions you may have.
All right, we'll go to the phone now. Operator, could you put through the first question, please? Hello, operator, are you there?
The first question is from Julia Wong. Please go ahead.
Hi, Dr. Hinshaw. Many parents I've spoken to say they want to have My Health records for their children who are 14 and under. They say it would be helpful and reassuring to have a physical record of their children's tests. Is the province working to make that available to children who are under the age of 14? And if not, what might be standing in the way? Also, just curious, we've heard many times that schools and businesses are getting a deep clean or deep disinfecting. What exactly does that mean? What protocol do they need to follow?
With respect to My Health Records, that is something that is being worked on to enable parents to have access to My Health Records for COVID-19 test results for children. I don't have a time frame on that, but work is absolutely underway as we recognize this would be of value for parents and for those children. With respect to the deep clean, there is detailed instructions with respect to what is required, perhaps, for each individual sector. And deep cleaning really means that a cleaning agent that has activity against viruses like COVID-19 is used on all surfaces in a particular area where there has been someone who's been infectious. So the guidance documents that are on the Alberta Health website, they do indicate the types of surfaces that need to be cleaned, and depending on the context, there is instructions with respect to cleaning or what must be done with items that may be difficult to disinfect, such as setting those aside for 72 hours. So if someone's interested in knowing what kinds of cleaning protocols are required for their particular sector, it would be helpful for them to consult those guidance documents, as well as then there's extra references, for example, to Health Canada's list of cleaning agents that are active against COVID-19 and the kinds of protocols that need to be followed, again, for the different sectors.
Operator, can you put through the next question, please?
The next question is from Carl Fissett, CTV. Please go ahead.
Hi, Dr. Hinshaw. I know this is something you've gone over before and have gone over just a little while ago today. I was wondering if you could clarify when it comes to outbreaks in schools, and I know the idea is to err on the side of not raising alarm bells when there isn't a need to, but is there a scenario where two students were in a school and infectious within a 2-week period, but that would not constitute an outbreak?
At the moment, we are, again, using that very strict definition. When we had first been working on our outbreak guidelines, we had envisioned that there would be some discretion left to, for example, a local MOH to determine if there had been transmission in the school or not. But what we're finding is that people are really wanting a very clear definition that's consistent in all circumstances. So it's possible that there may be 2 cases within a school community, but only one of those cases was present while in the school and infectious, and those 2 cases are not connected to each other with respect to the school. In that case, we wouldn't declare an outbreak, again, if there's a second case that didn't cause any transmission and didn't acquire it in the school. So that may be an example, but whenever there are 2 cases within 14 days where transmission could have occurred within the school or those 2 students were infectious while in the school, then that currently meets our definition of outbreak, which again does not, at the moment, none of our outbreaks have been shown to have transmission within the school environment.
My sincere apologies. I forgot to mention that in addition to Dr. Hinshaw, we also have Andre Corbould, Deputy Minister of Alberta Education, here to help answer questions if needed. Operator, could you put through the next question, please?
The next question is from Matt Woodman, CTV Edmonton. Please go ahead.
Hi, Dr. Hinshaw. Maybe I'm remembering this quickly, but early on in the pandemic, I thought I remember the Premier saying at some point this summer we would have the capacity to test about 20,000 Albertans every day. But today you're saying we shouldn't expect 19,000 tests on a daily basis. So am I misremembering that, or was perhaps the province just being a little over-optimistic in its ability to complete that high number of tests in a single day?
What's important to know about the number targeted for a single day is that we need to have surge capacity. So we need to have the ability to move through 20,000 tests in a single day if we should need to. And as we're looking at the fall, we know that we need to be able to move into a surge capacity if we should get increased circulation of other viruses like influenza, if we should see an increased spread of COVID-19, that we do need to have that ability to test that many people in a single day. But there's a difference between surge capacity, being able to test a certain number of people in a particular day, and the requirement to test that many people every single day for months and months. And so I think that distinction has perhaps been lost, but what we need to do is we need to have that surge surge capacity. So absolutely, as the lab has demonstrated, we have that surge capacity that we committed to having, but we do not need to maintain that capacity every single day. Again, we need to focus on moving our highest priority samples through as quickly as possible, those who are symptomatic, those who are close contacts of cases, those who are in outbreaks. And if our case numbers should increase and we should see more symptomatic individuals, we absolutely need to be able to surge to that, which, as I've just said, we've proven that we can. But the intention has never been to have that kind of a sustained capacity every single day.
Operator, can you put through the next caller, please?
Next question is from Dylan Short, Edmonton Journal. Please go ahead.
Hi, Dr. Hinshaw. You had spoken about the backlog of tests there. I was just wondering, at this point, where does that backlog stand? Is it gone completely now? And about how long should Albertans wait to get the results, or expect to wait to get the results back?
I don't have the current backlog information. That would be something Alberta Health Services would likely have. So I think, again, with how long Albertans should expect to wait, those specific questions, I know that in the past Albertans sometimes have had to wait up to a week or more to get test results, and we're trying to compress that down to just a couple of days. I'm not sure where we're at in that compression time frame, but again, we're working as hard as we can collectively with the efforts of many, many people across the system to be able to get that backlog down. And I'm told that the majority of those who are currently going for testing are choosing the option of receiving their results by text. So that's one of the things that we've done, is enabled people to get their results immediately as soon as they roll off the testing machines. People will receive, if they've signed up for that text notification. So the time to wait between lab test and result notification is now essentially zero. And again, now we're working on some of those other parts of the system. So we'll be able to provide more information in the days ahead with respect to where we're at with that. But again, right now, what I can say is that every effort is being made to reduce that time to just a few days.
Operator, could you put through the next caller, please?
Next question is from Courtney Theriault, City News. Please go ahead.
Thank you very much for taking my question, Dr. Hinshaw. Part of the updates, obviously, the last week and change have been identifying the number of infectious cases in schools as well as the number. But that doesn't take into account the number of students who've had to then be tested and self-isolate. So the question I have is, do you have a number of the students across Alberta that have been forced into taking those precautions? I know it's 237 here in Edmonton, according to Public and Catholic. So do you have that number? And should that number be made public in order to give us a better sense as to how much of an impact these one or two cases, even right now, are having in schools?
From the public health side of things, our records show the number of contacts that an individual case has overall. So that's not necessarily just the school contacts, it's all their contacts that they have in their whole life. So we are working on the public health side to see if we can differentiate, but I'm not sure if that's information. I don't know, Deputy, is that something that you would have access to, the number of contacts?
Yeah, thanks, Dr. Hinshaw. I don't have the specific numbers with me here today, but we do track the total numbers of students impacted because, of course, we're working with the school boards on what they need to adjust, including additional online supports. I think it's important, though, to make explain what number of schools are carrying on and operating that haven't been impacted at all by COVID. And right now, there are 2,380 schools that are open and operating without any cases at all, which represents approximately 98% of schools in Alberta.
Operator, can you put through the next caller, please?
Next question is from Sean Fennett, CTV. Please go ahead.
Hello, Dr. Hinshaw. I'm just wondering how you would characterize the number of cases we've had in schools. We're just a couple of weeks into school, 42 cases in 35 schools today. Does that strike you as, wow, that's a lot more than you expected to see? Or is it like, hey, that's not too bad considering the number of students that have returned to school all kind of within this quick period all of a sudden right now? How would you characterize the number of cases we've had?
I would say that we have seen an increase in our daily case numbers over the last few weeks. So This number is consistent with, again, that overall rise in community transmission that we've seen. I recognize, as I said earlier, that each case that we've identified does inconvenience those families of the individuals, the other students in that class. And I know that that's not easy for those parents who need to make adjustments to their schedule to be able to support their child to be at home for 2 weeks. And so again, while the total number of cases is not surprising given the community transmission numbers that we have, again, it's a reflection of the fact that we all really need to do our part to minimize community transmission in order to keep schools as safe as possible and minimize the impact that we're seeing these cases have in schools.
All right, we have time.
Oh, sorry, just one additional comment from Deputy Minister.
Yeah, thanks, Dr. Hinshaw. I also just wanted to highlight that, notwithstanding the cases that we're dealing with in the schools, and we're very much focused on those for sure, right now there are 720,000 students being educated in the system here in Alberta, and 138,000 of those are kids who have chosen, or parents who have chosen to take online options. So notwithstanding the cases that have popped up here in the last couple of weeks, education continues to be delivered in Alberta, either at school or in some limited case online.
All right, we have time for 2 more questions. Operator, could you put through the next one, please?
Last question is from Lauren Pullen, Global Calgary. Please go ahead.
Hi, Dr. Hinshaw. Thanks so much for taking the time to answer my question here. The World Health Organization is reporting a record one-day increase in global coronavirus cases. You did say off the top of your address that things are manageable by our public health here, but again, that numbers are rising. At what point do we reach that second wave or that concerning number that would change things? And any other reaction to our increasing numbers or that WHO stat?
I think the WHO stat is really reflective of the fact that all of us around the world are trying to deal with this pandemic, with the impacts it's had of direct infection on people, with the impacts it's had as every country around the world has had to make decisions about how to manage COVID-19 and some of the impacts those decisions have had. And naturally, over time, I think we're seeing this COVID fatigue or pandemic fatigue and the impact of that as numbers start to go up quite significantly in many countries around the world. I think that locally in Alberta, we have been able to keep our numbers relatively manageable. Again, we have been going up, and especially over the last few days with the increased testing, we have seen, again, numbers that are higher than I think would be ideal. However, we don't have a single cutoff in terms of the number of daily cases that would trigger a particular action, because what we know is we need to look at not just the number of cases, but where the cases are being spread, who is impacted by the cases. Is it individuals who are at the highest risk of severe outcomes, or is it spreading into those groups? And as long as we're able to maintain our case numbers at a relatively steady rate, again, kind of keeping around that 100 cases per day, ideally slightly lower, we're going to be able to manage this and be able to balance making sure that we have minimal impact on the other health issues that people are dealing with. And so really, again, it's about that balance. And so there's no one single number. We just need to keep monitoring, as we have been doing for many months now, the impact of COVID-19, the impact of the restrictions, and making sure that we're keeping those two things in tension, and that we are not following the path that some other countries are experiencing, where health systems are starting to be overwhelmed, where their acute care capacity is struggling to keep up, and they are seeing rising impacts again with these second waves.
All right, operator, could you put through the final question for us today?
The final question is from Kean Bexley, Rebel News. Please go ahead.
Hi, Dr. Hinshaw. Thanks for taking my question today. Ontario's Deputy Public Health Officer said that mass testing can yield up to 50% false positives. What is your estimate of false positives in Alberta? And if it's as large as it is in Ontario, why are we doing it? And are we delaying reopening the economy because of those false positives?
One of the challenges of asymptomatic mass testing is that it can pick up individuals who perhaps had COVID-19 maybe a month prior. Perhaps they're no longer infectious, but they still could test positive if they're shedding the virus. And so one of the challenges, again, as we're doing the asymptomatic mass testing is to distinguish between those who perhaps are infectious, currently actively infectious, and those who maybe had infection a while ago. And that, I can't comment on exactly what the Ontario's Deputy Chief MOH had been commenting on, but that is one of the biggest challenges of that mass testing. What we've seen from our mass asymptomatic testing in Alberta is a very, very low positivity rate. So we're looking at around, when you look at thousands of tests that are done across Alberta every day, we're seeing on average only about 6 cases per 1,000 people tested, which indicates again that the risk of someone being actively infected when they have no symptoms and no exposure is very low. And so that's not what's driving our case numbers. Our case numbers are being driven by those who are symptomatic, by those who are close contacts of known cases, and by those who are involved in outbreaks. The number of total cases we're seeing through our asymptomatic testing is a minority of our overall cases. And again, to get our economy restarted, we can't ignore COVID-19. We have to hold two things in balance. We do need to move forward with all those things that support Albertans' health, the ability to work, the ability to socialize, the ability to engage in activities that keep people healthy like exercise and recreation. And we also need to keep COVID-19 restrictions in place to the level that allows us to have all those other things that we need for our health, as well as minimizing that transmission, because we know that if transmission rises in some other places around the world, that causes significant impacts on the economy. So in order to have both of those things, we need to work for that balance.
All right, thank you all for joining us today. Dr. Hinshaw will provide another update later this week. Have a good day.